goodness, welcome to another video of your daily dose of NCLEX. Today we have an amazing topic, a very special, I mean it's not that special, but we're going to talk about prioritization and PCA. All right, listen, I forgot to write that on the board, but when it comes to prioritization, the technique we use for prioritizations are two, right? Two NCLEX, oh my God, I should have written this before, two NCLEX strategies, right? So we've got nursing process, which is super easy, everyone knows, but our algorithm for prioritization is called, can you see right here? ABC's PEEP, right? So we'll go over this and we're gonna talk about it. But before, of course, you know, I'm gonna flip the board and we're gonna have a question. We're gonna talk about, I mean, the question is mainly about prioritization. We're gonna break it down. And after that, I'm gonna teach you the different strategies when it comes to prioritization. I'm also going to go over content when it comes to PCA. What are the most used drugs when it comes to PCA, all right? But before we start, I wanna give you a treat. Just because you clicked on this video, I wanna give you my real NCLEX World versus NCLEX Textbooks ebook. You know what this ebook, when our students go to the test center, after they get out of the test center, what do? They text their coach, myself or any of the coaches on the team, and they send us the topics that they got on the real NCLEX. What did we do? We took screenshots of those topics, we put them in one ebook, and I want to give you this ebook for free so that you can look up what is currently being asked on the NCLEX, all right? Awesome. Let me flip the board and read the question real quick. The nurse receives a report from the night shift, all right? So from the night shift, nurse, all right? So the nurse receives a report from the night shift nurse. Which patient does the nurse see first, all right? Listen, so that's the thing. And I grabbed the red marker. That's the thing. Anytime you see the word first, what are you going to think? You're going to think about prioritization. And anytime you think about prioritization, you're going to think about two NCLEX strategies. Now, on my program, the Netflix of NCLEX that my students use to pass their NCLEX, we've got almost 15 NCLEX strategies. For prioritization, there's two: nursing process and ABC's PEEP. Now, let me tell you something. There are four major type of questions that are asked on the NCLEX. We've got prioritization, super important, like you cannot neglect it. There are books that are like 500, 600 pages just talking about prioritization, right? You've got patient room allocation, you've got infection control, and you've got delegation. It's super important to know NCLEX strategies when it comes to those questions, because if you know the NCLEX strategies, those questions are just a game. It's just pieces of the puzzle. You put them together, you get the right answer, all right? So now, you know, if you're one of my students or you watch one of my previous videos of the Daily Dose of NCLEX show, you know, when we read a question, we read it 3 times. The first time is going to be general reading. The second time we're going to break down keywords. We're going to look for keywords and we're going to highlight them. And the third time we're going to rephrase the question in our own words so that we understand what the examiner wants from us. Now you're going to tell me, hey Mo, am I going to read the question 3 times and then I'm going to read the options and break them down? Dude, that's going to take me like 4 or 5 minutes. I've got time, I'm sitting for the real deal. I'll be like, dude, you have not watched my How the NCLEX is Graded video, otherwise you would not say that, because time is not your enemy, only wrong answers are, right? That's why with my students, when I tell them when you go for the real test and you've got that timer in the right hand corner, you just push it away, because you can make it not show, because time is not your enemy. You're not worried about time. You're only worried about getting the right answers, all right? So now I'm going to read the question a second time. The nurse receives report from the night shift. Which patient does the nurse see first? Of course, there's only one keyword, which is first, which is prioritization, all right? I've got 4 type of patients. When I have 4 type of patients and I want to choose which one I've got to see first, this is a prioritization question where I am going to use the second strategy for prioritization, which is ABC's PEEP, all right? I'm gonna write here, oh no, I'm not gonna write here, all right? So now I rephrase the question in my own head. I'm on the unit, I just received, you know, report from the night shift, and I've got 4 patients that I need to see. Which patient should I go see first? Now, what I'm looking for the most unstable patient, the most patient that's worrisome, that's worrying me, that I need to check and make sure that I need to check and assess and make sure that that patient is okay, all right? So that's what I'm looking for. Now, I read the options, and with every single option, I'm gonna break them down as per ABC's PEEP, right? ABC's PEEP. Where do they fall? All right, of course, you know, A is airway, B is breathing, C circulation, S safety. When it comes to the PEEP, I don't want to give you the full scoop, right? Maybe I will. But when it comes to the PEEP, you've got to attend my free webinar and learn more about what I want to teach, or more about how I help thousands of students pass their NCLEX on the very next attempt. So if you want to join my free webinar, all you have to do is text me, and you can find my phone number on the screen or down in the description box. Just go ahead, text me, holler at your boy, all right? So option number 1. Patient 3 days post CABG. All right, CABG is coronary artery bypass graft, all right? Is getting his AV wires, AV atrial ventricular wires, removed today, all right? So you know a patient, when they go for CABG, which is bypassing the coronary arteries, what's gonna happen is that that patient will stay in CSU or whatever critical care area that they're supposed to go to, right? So in the critical care area, they have chest tubes, they have whatever, but one of the things they have is the AV wires. Those AV wires are hooked to their, you know, AV node, SA node. They are hooked to the heart, right? And those wires are coming out of the chest, because if that heart stops beating, instead of opening the chest and defibrillating the heart, what happens is they just hook two things to the wires, and then they defibrillate the heart, right? So in this case, those wires are removed on day 3, all right? Is this patient not stable? Let me tell you from experience, because I worked that unit maybe like 12 years ago. I've been a nurse for 15 years. But those patients are stable as, you know, right? Chest tubes are removed, the patient is okay, the patient started, you know, sitting at the side of the bed, started walking few steps. Those patients are okay, there's no threat. That's why we are removing those wires, all right? So that patient is stable. We're just waiting to remove the AV wires. So should I see that patient first, all right? Is there airway? Is there breathing? Is there circulation? So this patient falls under maybe safety, all right? All right, let's move to the other one. The second patient is a patient with diabetes mellitus type 2 getting cardiac catheterization at noon, all right? So this patient also falls at safety. This patient has a heart problem, right? Maybe he had a, what do you call it? A myocardial infarction or angina, and they did echocardiogram, and you know, they did all the cardiac tests, and they found out that his coronaries, coronaries are blocked. So what this patient needs is cardiac catheterization. Now, this is not an emergency because it's scheduled at 12 noon, which means that this patient is stable, right? So this does not fall under A, B, C, or for me, I would put it under C or S, but to me, I'll put it under safety, right? So I just want to make sure that this patient is ready and is prepared to go to the cardiac cath. Of course, you've got to shave the patient, you've got to make sure you go through the checklist. So that's why I say safety, because that patient requires assessment only, all right? Even though that the problem is cardiac, but it's not cardiac right now, right? So this is a procedure. Option number 3, a patient 36 hours post-operation on PCA, which is patient-controlled analgesia for pain, all right? So listen, this patient is 36 hours post-surgery on PCA, right? So on pain management. So PCA, if you know, which we're gonna talk briefly a little bit, the two most popular drugs for PCA are morphine sulfate and fentanyl, all right? What do those drugs cause? All right, if you know what PCA is, it's a machine hooked to the patient's central line, or I'm not sure if it's hooked to a peripheral line, but let's say it's hooked to a peripheral line. And the patient is sitting in bed post-surgery. And what happens is, every time they feel in pain, they can click a button and give themselves a dose of, or a microdose of the analgesia, right? Now, this PCA is controlled, which means that they cannot give drugs to themselves at any time, right? So there's a time period where it's a safe zone. Let's say they gave a dose for themselves right now, they can't give the second dose until 15 minutes pass by. So if at 10 minutes they try to give themselves another dose, it will not allow them, right? So it will only allow them after 15 minutes pass by. All right, so those patients, all right, I need to, what I'm thinking like as a critical nurse, Those patients, side effects of morphine sulfate and fentanyl, they might cause respiratory, what should I write? They might cause respiratory depression. All right? They also cause hypotension, decreased blood pressure. All right? So I got to check on that patient, man, because I'm hitting two things, right? I'm hitting breathing and I'm hitting circulation, right? With respiratory depression and decreased blood pressure. So I'm gonna keep this option because this patient could be unstable, right? Now, option number 4, a patient awaiting heart transplant. All right, a patient awaiting heart transplant. Is that patient stable or not? You know, a lot of people, when things come to like cardiac conditions, they're like so scared. For example, this patient is waiting for heart transplant. What does it mean? Maybe he has cardiomyopathy or cardiomegaly in his heart. It's just not serving him, right? And he's waiting for a transplant. It could come today, tomorrow, after a week, after 2 weeks. We don't know, right? So, is that patient stable? Of course he is stable, right? Is that patient normal? Of course he is normal. Now, what's wrong with this patient? Patients who are waiting for cardiac transplant are normal people. They're just slower. They act slower. They have a little bit of fatigue. They get weak faster, right? Because their heart cannot pump blood to the organs and, serve their needs, right? So that patient is normal, but they just are weak, fatigued, slower, right? Does it mean he's unstable? No, he's not. He's a stable patient. He's just waiting for heart transplant, all right? So the most unstable patient is option number 3, and that's the right answer. And I hope now you understand how we break down questions. You don't have to freak out, and you have to logically think about those patients and understand what the options are all about, all right? Now, let's talk a little bit about ABC's PEEP, all right? So I said A is airway, B is breathing, C is circulation, S is safety, P, I said you've got to attend my free webinar, right? So text me. My phone number is in the description box, and I will sign you up for a free webinar. But listen, don't take the free webinar on your free lunch break or whatever. Only on your off days, all right? So now, let me talk about the 2 most popular drugs when it comes to PCA, all right? We've got 2 drugs. We've got morphine sulfate and we've got fentanyl. Usually fentanyl is used as complementary to anesthesia, right? Now, when it comes to side effects of fentanyl, you've got respiratory depression, apnea, hypertension, and bradycardia. Now, when it comes to nursing consideration or nursing care, with those type of patients, you've got to always keep a crash cart nearby or a station cart, right? Either outside of the room of patients who are on PCA or inside the room, depending on how stable they are or unstable or what type of surgery they got, all right? Now, the second thing that you need to pay attention to is that those drugs or fentanyl should not be administered with barbiturates. Huge contraindication and huge respiratory depression, all right? Now, when it comes to morphine sulfate is the #1 choice of drug when it comes to pain management. Now, when it comes to side effects, you've got nausea and vomiting and constipation. It's very huge, right? Constipation, that's why patients with morphine sulfate, you've got to put them on stool softeners, all right? Now, you've got respiratory depression, you've got hypertension. Also, what's important is that those patients, their cough gets depressed, all right? So patients after surgery, you encourage the patients to cough so that they expectorate, whatever secretions or phlegm or sputum they have in their lungs after surgery, because they stagnate at the bottom of the lungs, right? And you also encourage them to cough, of course using a pillow depending on the surgery that they have, because you don't want the base of the lungs to atelectasis, right, to close, right? That's why you need to understand that patients who are on morphine sulfate, their cough got depressed or gets depressed. That's why you need to encourage them to cough more, all right? Now, when it comes to nursing consideration or nursing care for patients who are receiving morphine sulfate, not just PCA, I mean morphine sulfate in PCA, but morphine sulfate in general, right? You've got to take vital signs, all right? Vital signs, blood pressure, because if the patient is hypotensive, which is decreased blood pressure, you cannot give morphine sulfate, right? If the patient has respiratory depression or respiratory rate, which is less than 12 breaths per minute, then you cannot give morphine sulfate, right? Or we call it bradypnea, right? Now, those are very important. You've got to take vital signs. Now, the next thing is If the patient experiences respiratory depression while they are on morphine sulfate, what do? Right? Morphine sulfate has an antidote. It's called naloxone. You know what I'm saying? So you've got to give that to the patient. Usually it's given nasal or, IV push. So you just give it to the patient and then the patients recover from the respiratory depression, all right? Listen, share this video, like it, comment below what are topics that you like me to talk about in the future. And please share this on your Facebook and your Instagram and tag me on Alpha Slice and NCLEX Q Bank on Instagram. Love your face. And one more gift. If you click the link below and get the free ebook, I'm also offering you the 300 Spartan medication e-booklet. This book, oh my goodness, it's amazing. You know when I told you my students, when they go to test center, after they get out, they text me the topics that they got. They also text us the drugs. So me and my colleague, Professor Aileen Burke, if you don't know Professor Aileen Burke, oh my goodness, have you been living under a rock? Go Google her. Professor Aileen Burke is a nationwide well-known NCLEX copywriter. She worked for NCSBN, for Lippincott, for La Charity, for Kaplan, all those big brands for the past 2 years. She has been one of our team members, and we worked together to create a Q bank with a new NCLEX generation questions. But forget about that. I'm just talking about this ebook, right? So if you click the link below, download the ebook, you will be offered this ebook. It is amazing. So what we did is all the drugs, most popular drugs that has been discussed on the real NCLEX. We did the research and we put the drugs, name of the drug, indication, side effects, and patient teaching, which is all you need to know when it comes to medication or medication calculation questions. All right, love your face. Share this video. Can't wait to see you on the next one. Peace.
Hi, I'm Jessica, and I found out today that I officially passed my exam. I'm extremely happy. I did it with the help of Joe and the Alpha Slice Academy. This has been a wonderful experience. Watching the live webinars was fun. It was it was filled with a lot of information, but the information that you need, it was realistic. It was straight to the point. And it really kept you involved, and it also kept you it kept your attention, and it wanted you to keep going and going and going. Like I have kids. I have 3 little kids. My oldest is 7. Then I have a 5-year-old, and I have a 4-year-old son too. And I have a full-time job, a part-time job, and sometimes I go into another per diem. But the thing about this program is you do it at your own pace. You can pause it and come back to where you left off. It isn't rushed because you're doing it at your own pace, compared to other NCLEX review programs that are pretty much what they give you. You keep up, or you just, if you lose track, that's on you pretty much. So it's kind of like you kind of like lose money out when you invest in a review, and you kind of can't really ask questions, and you can't go back, you can't rewind it and go back to review what was said before. And that's the good thing about the Alpha Slice Academy, is you're able to pause it, go step out to the bathroom, go run grocery store, go to work, and come back to where you left off. And you don't have to take off of work. Now, if you're trying to, if you don't have kids and you're able to do the program within the 4 weeks, that's great. But for the, people with different situations, working mothers, single mothers, this program is ideal for single parents and for anybody who's looking for that kind of hands-on feel and that support. The live webinars, oh my gosh, it was amazing. It was like you were in the classroom, you was there. It's like Joe and the lectures, like he was there with you. If you have any questions, you can always text them on WhatsApp. That was the best part. I didn't really have much to text most of the time, but I just text just for the hell of it to see if somebody would respond, and they always did. The program was great. It's amazing. I already told all my friends about it. I recommended it to everybody I know who's a student or who I know who hasn't passed yet. The program is amazing. Like, there's nothing like it. Like, forget about those review books. Forget about all the Saunders and all those. I have so many books that I haven't even opened, and I took my NCLEX before once, and after that one time, I said no. I'm not prepared. I'm gonna do reviews until I feel confident enough. The minute I started the reviews with Alpha Sliced, it was just a whole different attitude. Like, my whole attitude about the NCLEX changed. It wasn't only about just questions, answering questions. It was about strategy and approaching the question differently. It really, really prepared me. I didn't want to take the exam so soon because I didn't get a chance to finish the whole program. I purchased the lifetime, but I didn't get a chance to finish it. And my ATT was expiring, and I had no choice but to take it before my ATT expiring. But I got like at least maybe 75% through the program. And my attitude already changed. I was already answering questions differently. I did it along with UWorld for practice. And so when I went to go take the exam, I applied everything that I learned from the bit of the program that I already started to review and I already studied. So with that knowledge and strategy that I applied to the exam, it was a breeze. I breezed through that exam. Like, I was shocked at the way I breezed through the exam. It was totally different from when the first time I took it and I didn't pass. The second time, I didn't want to take it. I had to take it because of the ATT, but I applied every bit of information and everything that was taught in the webinars from the Alpha Slice Academy and Netflix, NCLEX, and everything that I applied just made it so much easier to answer the questions and to understand the questions, and just the whole attitude of the NCLEX. It was just, it was amazing. And I think the Alpha Slice Academy, Joe, you guys are really, really special. And thank you. And I recommend everyone to do this review. Don't look anywhere else. It's a waste of time. It's a waste of money. Alpha Slice Academy is where it's at. Like, this is where you need to do your review.